Folks, I'm Dr. Fazil. You're watching Dr. Fazil TV show for 2025 March, month of March. So the topic for this discussion is palpitation, right? Very common symptoms in our day-to-day practice. People come with symptoms saying they have palpitation. Sometimes they have more than palpitation, like they have lightheadedness or syncope or near syncope. So we have to understand, because this is important topic, because if you do pass out while you're driving, it could be very dangerous for you and your family and people around you. So we have to take it seriously. So palpitation means when you can feel your heart beating, right? So it has many reasons. Physiological means if you have anxiety, if you are running, if you're exercising, your heart rate will go up. That's natural, and you will feel your heart is pounding, right? But there are some pathological causes as well. Again, we're going to use our hologram as usual to make it easy to understand. So let's bring up this hologram here, and you can see there's a heart. It has 4 chambers. Heart have its own electrical system. You can see on the right side we have this little node. We call it SA node, and then it goes here, and then it goes into 2 different tracts, and then it spreads to both chambers at the bottom of the heart, known as right ventricle and left ventricle. And when it generates electrical impulse, the heart contracts and it functions, right? But when it functions too fast, the heart rate go too fast, it causes palpitation. So the palpitation could also be due to other reasons. For example, if you have low blood count, anemia, right? If you have a low blood count, your heart rate will have to go up to compensate for lack of oxygen to your body parts. So anemia is a cause of that. Fever, if you have a fever, physiologically your heart rate will go up. If you have pain, heart rate will go up. But if you have a heart condition like heart failure, your heart rate will go up. If your blood pressure is low, heart rate will go up, and you will feel palpitation, right? But there's a most common cause is palpitation is due to atrial fibrillation. So let's bring up another hologram. That hologram goes on this side. So here you can see atrial fibrillation. Heart rate is going. As a matter of fact, this is. Let's have this hologram go on this side. So let's bring this electrocardiogram, and you can see this electrocardiogram, which is EKG of the heart. There's a P wave, and there's QRS and T wave, and PQRS and T wave. So that's a normal EKG. Let's have this EKG go away here. Let's bring another EKG, and you can see there's a little fibrillation, and then there's a big this giant wave, and then fibrillation and giant wave. And what happened is that SA node, which we discussed before, it is either that or the muscle around the SA node start to fire or become activated pathologically, causing a lot of electrical impulses transmitting from top of the heart to the bottom of the heart, and causing heart rate to go very fast and irregular, right? And we call it atrial fibrillation.
The Dr. Fazil Show is now available to view at home on Roku devices and YouTube. Catch up on your favorite episodes right on your phone, available on YouTube and the BioFamily Clinic app. The Dr. Fazil Show is available in many doctor offices across Yuma, Arizona. Pick up your free copy of Health Tips magazine, available throughout Yuma, Arizona, or read our digital version at healthtipsmagazine.com.
So atrial fibrillation is the most important pathological reason which we need to address. So if you do have palpitation, if we cannot diagnose with history and physical examination, we can do some diagnostic testing, including using something known as event monitor. Here you can see in this picture, there's a little machine, either a Holter monitor or event monitor. The difference is Holter monitor is generally for one day, is a bulky machine. And you can see, well, I'll bring another hologram. You can see this is a holder monitor, which is have some electrodes on the chest and a little bulky machine on the side. We generally use it for 1 day. In a more fancy way, let's bring another hologram. You can see there's a little bit, a little white strip in the middle, and there's a phone in your pocket. So if you have symptoms, you press the button and it records. It records 24, as long as you have it on yourself. But by pressing the button, it becomes easy for the technician to mark on the start of the rhythm where you did have symptoms. It is known as event monitor. Generally, say for 7 days, it can go up to 30 days. Let's bring another hologram. This is known as loop recorder, right? So loop recorder is a more long-term investigation tool. We put this little device inside the chest, and it can stay inside you for years and years. And the technician is monitoring your heart in the real time. So we can see if your symptoms are not very frequent and you're having it once a month or every 2 months, but then you pass out, even though it's every 2 months, but if you pass out, obviously it's significant because all you need to be wrong time at the wrong place, and that will cause a lot of bad outcomes, right? So we need to make sure that we don't miss anything. So if we cannot find on holder monitor or event monitor, then we use loop recorder. And loop recorder can monitor your heart for long-term time frame. And if we find that you have, a pause in your heart beat, or or fast heart rate due to atrial fibrillation, and that's causing palpitation and causing symptoms, then we fix that, And obviously atrial fibrillation can cause heart, strokes as well, and that's not good. It can cause syncope, that's not good. So that need to be diagnosed and fixed appropriately, right? Again, atrial fibrillation is a whole new topic. We can talk in another session, but it can cause strokes, it can cause syncope, lightheadedness, and poor heart function, or even heart failure, right? So folks, don't take palpitation lightly. It is an important clinical symptom. If you do get palpitation, then let your provider know so he can, understand where it's coming from and what can be done to prevent it and fix it, And that's was the nutshell about palpitation, folks. So on that note, I will be back next month. Thank you for watching Dr. Fazil TV show, folks. And God bless you, and God bless America. Have a nice rest of the month. You were watching Dr. Fazil TV show. Thank you so much.